So the PROfound study was designed based on multiple observations, beginning with the fact that there is a significant prevalence of HRR mutations in patients with metastatic castration-resistant prostate cancer, emerging data from olaparib from the TOPARP-A trial, highlighting the higher response rate in patients with these alterations. And of course, as the audience are aware, targeting PARP has been around for a while, specifically in breast cancer and ovarian cancer at the time we designed the trial. And so when we designed the trial, we wanted to focus on not just the BRCA 1, 2, and ATM, but rather what I would call the non-canonical DNA repair genes or HRR mutation genes also, to see if, in fact, is there any response to olaparib therapy. So the trial was designed as it was a phase 3 trial with a primary endpoint of radiographic progression-free survival, and it included 2 cohorts. Cohort A was the primary cohort, which included patients with BRCA 1, 2, and ATM, and then cohort 2 had one of 12 other genes that were involved directly or indirectly in the DNA repair pathway. And the patients in both arms were randomized 2-to-1 to olaparib or physician choice. The physician choice would have been either enzalutamide or abiraterone and prednisone. I should point out that the trial was rather liberal in terms of the number of prior therapies. So many of the patients, in fact, have seen chemotherapy, other potential treatments for castration-resistant disease, but the critical requirement is that they have to have been exposed to either abiraterone or enzalutamide. And then the patients were randomized, as I mentioned, 2-to-1, and the primary endpoint, radiographic progression-free survival, with the several other secondary endpoints, including radiographic progression-free survival in the overall cohort, and then measurable disease response, time to pain progression, obviously evaluating adverse events, and so on.